Hello everyone, in this video we are going to see about Kala Azar. What is meant by Kala Azar? Kala Azar is also known as leishmaniasis and it is also known as black fever or dum-dum fever. Leishmaniasis is a genus form of trypanosomatic protozoa which causes a fatal vector-borne parasitic disease. Usually, the susceptibility of this disease is general. This disease usually occurs children in the age group of 5 to 15 years. After malaria, leishmaniasis is the second largest parasitic killer in the world and it is endemic in many parts of Africa, America and Asia. The most common causative organism of Kala Azar is Leishmania donovan or Leishmania donovani or Leishmania infantum. Leishmaniasis is categorized into three types, that is visceral leishmaniasis, cutaneous leishmaniasis and mucocutaneous leishmaniasis. What is meant by visceral leishmaniasis? This is the most serious form and becomes fatal even untreated. Cutaneous leishmaniasis. This is the most common form which causes a sore at the bite site which heals him or her in a few months to a year. Mucocutaneous leishmaniasis. People with mucocutaneous leishmaniasis have skin ulcer which will spread the tissue damage, especially nose and mouth. Sources of infection. The main source of infection for Kala Azar is from an infected person and bites of sandflies. In some endemic areas, presence of high incidence of the infection among cats and dogs. As we know, Kala Azar is transmitted through the bite of infected sandflies, which are known as Phlebotomus argentips. Fly is infected by sucking the peripheral blood of infected person or by ingesting organisms which are present in the skin of an infected person. That is why Kala Azar is known as insect-borne disease. Signs and symptoms of Kala Azar. Fever is the main symptom. It would be irregular or chronic nature, restlessness, rigor, vomiting, weight loss. Patient become very weak and lean, spleen and liver enlargement, and lymphadenopathy. Incubation period. This is generally of 2 to 4 months, but it may be as short as 10 to 15 days and as long as 19 months. And next is diagnosis. It is usually depends upon the patient's signs and symptoms. The common procedures are blood test, complete fever profile, serological testing, DAT and antigen detection test. For patient with cutaneous leishmaniasis, tissue sampling will be done, that is smear and culture. For patient with visceral leishmaniasis, bone marrow biopsy will be done, skin test, PCR test, serological tests, and inoculate serum of infected person in lab and animals. Prognosis and complication. Many complications will occur if the disease is untreated. The most common complications are gangrenous stomatitis, dysentery, and pneumonia. Treatment. Again, the treatment is based upon the signs and symptoms of the patient. The most common drugs used for leishmaniasis is sodium stibogluconate and meglumine antimoniate. Prevention of Kala Azar. Abolishing the breeding places of sandflies with DDT, sanitation measures, personal prophylaxis, use of repellents gives temporary protection, destruction of all infected dogs and cats, especially in those places where there is high endemicity, proper sanitation of houses, remove or eliminate the vegetation near house like animals in the houses, thatched roof, rubbish, dump floors and pits near house. supplement residual spraying by aerosol of bed nets, education to the public concerning mode of infection and how to control the sandfly should be given to all. Control measures. Isolation of the patient. Survey should be carried out in areas of high incidence and location of endemic foci. Investigate the source of infection and contacts. Coordinate the programs of control measures entered into by neighboring countries where this disease is exactly prevalent in form. And preventive measures to be followed strictly, mainly destruction of sandflies, the breeding places and sandflies. What is the role of nurse for patient with Kala Azar? Preventive and control measures must be followed strictly. Record of vital signs, fluid maintenance, giving medication as prescribed by the physician. Observe for any complication. If anything occurs in the patient, then it must be informed to the doctor. WHO's new roadmap for 2021 to 2030 at global level to prevent, to eliminate and eradicate a set of 20 diseases termed neglected tropical diseases by 2030. The WHO has also established the GPELF, that is Global Program to Eliminate Lymphatic Filariasis, Onchoriasis and Kala Azar by MDA, that is Mass Drug Administration. The target set by GPELF in 2000 to eliminate these diseases globally by 2020, it was not achieved due to COVID-19, but the WHO will accelerate this work to achieve this target by 2030. The central government has also taken several steps to achieve its goals of eliminating Kala Azar from India by 2023, including by building Pakka houses through the Pradhan Mantri Awas Yojana, rural electrification, testing treatment, periodic high-level review and award distribution. The center is also supporting the states in active case detection, surveillance, treatment and supply of diagnostic kits and medicines and sprays.